Good morning, everyone. It's my pleasure to report on two major projects undertaken by Bionano's clinical affairs team in collaboration with physicians and scientists at 9 different institutions across the United States. The first study that we will discuss is the optical genome mapping experience with prenatal samples. This is a multi-site evaluation and validation study. Currently, this particular study is at about its midpoint. So in this first phase of the prenatal testing cohort, there are 123 unique cases that have been collected. From these cases, there will be 200 analyses, but again, only 123 unique cases. 114 of those 123 come from cultured amniocytes. The cases have been presented by 3 different diagnostic labs in the United States, and the testing has been conducted at 5 different OGM data collection sites. I will note at this point that the majority, 75%, required 2 or more standard of care SOC tests in order to come to a report. In the end, you will see that there's 100% concordance between OGM and SOC results. The clinical indications for testing of these 123 cases, they are really heavily loaded with follow-up of NIP, non-invasive prenatal testing, or ultrasound findings. Those 2 clinical indications account for 75% of the cases. There are lesser indications such as advanced maternal age or positive family history, which you will see on this slide. But at the outset, we should understand that almost all of these cases come from NIP testing or ultrasound testing. The particular methods used by standard of care in sending them to us include chromosomal microarray test, CMA, karyotyping, and FISH. And again, the majority of these cases required 2 or more of these SOC tests in order to report out. On this particular slide, I only want you to note that aneuploidy accounts for the greatest single clinical indication and finding of structural variants, followed by deletions and then by duplications. Of the reports for these 123 unique cases, 62% of them had pathogenic findings, and almost 2% of them had a likely pathogenic finding. A lesser percentage, 27 cases or 22%, had variants of uncertain significance. I will show you just 2 cases. I mentioned that the most common structural variants found was aneuploidy of one type or another. This is an example of triploidy, and you can see the split screen on the circus plot here, and on the VAF track, again, the copy number split. So this is what triploidy on OGM shows, what it looks like. A second case, which is a little more difficult, is an example of complex abnormality with a deletion of XP shown here, and a duplication of XQ shown here. And again, on the plot to the right, you can see the deletion and the duplication of the X chromosome, deletion of the short arm, and gain of the long arm. So in this phase 1, there was 100% concordance between OGM findings and the findings by standard of care testing. The status of this at the moment is the preprint was put into medRxiv in 2022. The full article was submitted for peer review beginning in July of 2023. A response to these peer reviews appeared in October, and as this time we're waiting on a decision regarding a publication time. So I'll move to phase 2, which is ongoing at this point. In this phase 2, there will be 219 analyses, or there have been 219 analyses begun. There are 219 unique cases, most of them again from cultured amniocytes. We will not have any duplicate or replicate samples in this group. Again, in this circumstance, as the cases were submitted, the 219 cases, 2 or more standard of care tests were required in 70%. These cases were provided for Bionano to analyze by 5 different diagnostic labs in the US, and the cases were tested by 5 OGM data collection sites. In this phase 2, the majority of the cases are prospectively submitted, but about a third of that number being retrospective in nature. At this point, the standard of care testing has shown 35.6% to have pathogenic or likely pathogenic results, and the OGM testing is pending at this point. From a variant of uncertain significance standpoint, the standard of care testing has reported out 8.7%, and again, the testing by OGM is pending at this point in the study. A preprint has been deposited to medRxiv. That was done just before the turn of the new year into this year. So what are the goals for the prenatal OGM testing during this year? Well, first we will complete OGM analysis of 500 prenatal cases. So there are 500 individual or unique cases anticipated, and during this year we will submit for peer review the results of these prenatal testing by OGM. Now, let me give you just a moment to look at the participants in these studies. And again, they are from 9 different institutions, all in the US. The second project that we will discuss is optical genome mapping of postnatal samples. We'll be discussing here the detection of structural variants, constitutional structural variants in these postnatal samples. The participating sites are all from the US. There are 9 different participating sites, 4 of which have provided samples for this study. The first phase of the postnatal study has already been published by Iqbal et al. In March of 2023, so we won't discuss that particular sub-cohort in this discussion. So in phase 2, we'll have a few more samples than in phase 1. We'll have 627 analyses. This obviously will expand the number of OGM analyses of these postnatal disorders. That will further assess and confirm the performance of OGM and its clinical utility. In addition, in this particular part of the study, this phase 2, we will evaluate the performance in a prospectively collected cohort. And even more important, I believe, we will evaluate the performance in a diagnostically challenging cohort, that cohort being autism spectrum disorder. In phase 2, there will be a total of 627 cases, 30 of which will be replicates. So there are 597 unique cases. And again, these are loaded with developmental disorders, intellectual disability, autism spectrum disorder, speech delay. There's a lesser number of different neurologic disorders such as seizures or hypotonia, and an even lesser cohort or a lesser number of cases with congenital malformations, which may or may not have additional anomalies. Again, in these 597 unique cases, the largest clinical indication is ASD or autism spectrum disorder. There is a lesser subcohort of intellectual disability or developmental delay. And then again, several other smaller subcohorts listed here. The testing in this phase 2 by standard of care testing is shown here. Again, 597 cases. 59% of these required 2 or more of these standard of care test methods. So these methods are FISH, karyotyping, and chromosomal microarray testing. There's a small group, 3 that had only next generation sequencing, and 44 that had rather targeted testing. The concordance of the OGM results and the SOC results is quite high, as you can see, above 99%, with only 0.3% discordant. So we'll look just a bit at these 2 groups, the retrospective group and the prospective group. In the retrospective subgroup, this is of a total of 597 unique samples. There are 405 that were collected retrospectively. And you can see that the OGM findings of path and likely path findings were slightly greater than the number of results from standard of care testing. Now, I'd like for us to take just a little bit of a detour here to give you clarification of a couple things. First, in looking at these results, we should recognize that not all of the pathogenic or likely pathogenic or VUS cases reported by SOC, standard of care tests, are the same as the pathogenic, likely pathogenic, or VUS reports by OGM. So this comparative chart may be a bit confusing, but I think if we just look at the top pink colored area, I think you will see what I mean. Over on the standard of care, among these 405 cases, SOC methods reported 7 likely pathogenic or pathogenic findings. And if you will notice on the right, OGM reported actually more likely pathogenic and pathogenics, but not all of those reported by SOC as likely pathogenic or pathogenic were reported by OGM. 6 of the SOC pathogenic and likely pathogenic cases here were lost to VUS findings and OGM findings, and 8 of the cases were shifted to non-reported or non-reportable cases. So the same thing happens with the VUS cases. VUS cases, again, 127 found by SOC, but those 127 cases got distributed in the OGM findings. Some of them remained as VUSs, some of them were found to be pathogenic, and some of them were found to be in the non-reportable group. So this tells us that there are new findings that have become apparent, new clinical findings that have become apparent since the original SOC testing was done and when the OGM testing was done. But this comparison chart shows the degree of difference between the findings in the two different groups. So if we shift to the prospective group, this is a smaller group. There are only 94 cases here, and in the standard of care results, there were 5.3 cases with pathogenic or likely pathogenic findings, and twice that number of findings by OGM. Now, this is a very interesting cohort. It has several different subcategories, but if you look at the entire cohort of autism spectrum disorder, there are 216 cases here. The OGM findings of path and likely path are slightly more than the findings by the standard of care methods. If you take the ASD subcohort, where ASD is the only finding, this total cohort up here includes ASD with other findings. This subcohort is ASD alone only, and in that cases, there again is over twice the number of likely pathogenic findings by OGM as opposed to the original SOC findings. If we look at it a different way here, ASD, autism spectrum disorder, coupled with intellectual disability or developmental disabilities, the two different testing results are fairly close. 9 cases by SOC measures and 8 cases by optical genome mapping. And again, if you look at the bottom where ASD is coupled with birth defects or other findings, standard of care measures found more cases, 19, with pathogenic or likely pathogenic changes compared to 16 by OGM. The third group that we're looking at is family-based inheritance cohort. There are only 41 cases here, and the OGM testing found that 23 of these 41 cases were de novo. 13 of them were inherited from either the mother or the father, and there's one case of paternal inheritance which also had a maternal VUS. And among those where only a single parent was available, there were 5 cases with pathogenic or likely pathogenic findings. So a small group that was included in these total 597 unique samples. I will show you just of interest what 3 cases look like. This first case was submitted with the clinical findings of developmental delay, feeding, and growth issues. It was described as failure to thrive, and I'm presuming by that it means issues in growth. The standard of care results were normal. However, OGM found abnormality in chromosome 7, a deletion of a number of exons in this AUTS2 gene. This gene is known to cause an OMIM disorder, 607-270, which is autosomal dominant developmental disorder number 26. A second case where there was normal standard of care results. The clinical finding was autism spectrum disorder. OGM had the ability to detect a 2 exon deletion of AP1G1. This is a newly found condition which causes intellectual disability and variable neurologic findings, including seizures. It now goes under the name of Usmani-Razzoudi syndrome. It's located on chromosome 16. So that's a recent discovery that was not known at the time of the SOC testing. The final one I find to be interesting. This is a finding on chromosome 9. This case was submitted because of recurrent pregnancy loss, and the standard of care testing did not give us any report. However, OGM was able to find an expansion of a hexanucleotide expansion area in this chromosome 9 open reading frame 72 gene. The reason this is of interest is that this gene is known to cause amyotrophic lateral sclerosis and another condition called frontotemporal dementia. So it's very important from a healthcare standpoint that this is found, although it does not explain the reason that the case was submitted, which was recurrent pregnancy loss. So in these postnatal disorders, the overall optical genome mapping analysis has really shown us that we can detect all type of structural variants, whether it's aneuploidy or triploidy, whether it's CNVs in the form of microduplications or microdeletions, translocations, inversions, and the lyse case showing the nucleotide repeat disorder. There's high concordance between OGM analysis in these cases and the standard of care measures. The benefits are numerous. Of course, OGM has a single platform rather than multiple SOC platforms. It's been tested in multiple sites with multiple operators using multiple instruments. The analysis is software assisted, so it's quite robust. A small consolidated workforce is what's required here rather than a rather complex workforce with the multiple SOC measures. And there's a short interval from the time that a sample is received until the time of reporting. So I think the findings, both in the prenatal, but particularly in this postnatal study, positions optical genome mapping very well as a first-tier technology for testing all of these postnatal disorders. If it is partnered with next-generation sequencing, one would predict greater than 50% yield in these disorders. So what is the status of this particular study? The preprint was published in medRxiv in December of 2022. The peer review study went out for review in June of 23. The review was completed and reported back to us in September. We responded to the peer review in October, and the publication is accepted now. We don't have the date that it will appear, but the acceptance letter came on December 14th. Let me again ask you to take a look at the participants and the institutions that they represent from around the United States that participated in this postnatal study. And again, acknowledgments to the families that participated in the study, to the consultants, to Bionano, and of course the Bionano Clinical Affairs team. Thank you all for listening to this report of the prenatal and postnatal projects that have been ongoing over the past 2 years at Bionano. Thank you.